alarming look at nursing homes across the country right now. In California, at one nursing home in the San Francisco area, 6 residents have died, 30 others have tested positive. In New Jersey, 10 residents have died at one veterans home, 2 more at another. And this is just over the past couple of days. Nursing homes have been at the epicenter of the outbreak since the very beginning. So is it getting better or worse for these most vulnerable populations? Joining me right now is Mark Parkinson, the CEO of the American Healthcare Association, which represents more than 13,000 long-term care facilities. Thank you so much for being here. The last time we talked was a month ago, and then you told me that this virus was a perfect killing machine for the elderly and that nursing homes needed help. A month later, do nursing homes have what they need? Is it getting any better? Because it sounds like it's getting worse.
Well, it's slowly getting better, but we are still fighting this incredible battle with 2 hands tied behind our back. One hand is the lack of equipment. We don't have enough masks, and this virus spreads, of course, through coughing and maybe just through breathing. And without an adequate number of masks, we just can't stop it. And the second hand tied behind our back is a lack of testing. We can now get tests, but it's taking too long to get the results back. So often, by the time we know we have COVID in our building, it's already spread. The really good news, though, is that we now have many examples of buildings that have been able to keep COVID out. Or more important, if they can find out early on that COVID's in the building, they've been able to isolate it. So what we now need is the country to rally around nursing homes and assisted living buildings the same way that it has around hospitals and get us the equipment and the testing that we need.
Why aren't nursing homes getting the tests? Why aren't nursing homes getting the protective gear that they need? Who is holding it up? What's the problem?
Well, the problem from the very beginning has been that, of course, this virus started in the very province in China that makes the mask. And so by the time it hit the United States, there was a massive shortage of masks across the entire healthcare spectrum.
Right.
The issue of testing is one that's going to have to be long studied, and somebody's going to have to figure out what went wrong with testing in the United States. The reality is there simply haven't been enough equipment or testing for anybody in the healthcare spectrum, right, including hospitals.
Do you think it's something specific to, like, nursing homes are just being left in the lurch or kind of being forgotten? Is obviously hospitals need to be getting PPEs, but nursing homes, right, they do as well.
Yeah, we feel like we've been forgotten. I mean, I think it's great the way that we've rallied around hospitals. We adore the hospital workers. They're heroes, and we completely support that. But the front lines are in nursing homes. The people that are going to the hospitals are coming from nursing homes. So if we don't stop it in nursing homes, we're not going to stop it in hospitals. And so far, the country just hasn't figured that out.
Now, on Tuesday, Los Angeles County's public health director told families that in their view, it would be perfectly appropriate to pull relatives out of long-term care facilities to keep them safe at this point. Do you agree with that?
In the overwhelming number of cases, that would be a huge mistake. The average resident in our facilities is about 85 years old, has many activities of daily life that they can't do. They can't feed themselves. They can't transfer themselves to the restroom. Most of them are in wheelchairs. Over half of them have dementia. They simply can't be isolated at home. They are in a safe environment in a long-term care facility if the equipment is there to take care of them adequately. So I would just say that in the vast majority of cases, bringing those folks into the general population would be very dangerous right now. And I'd be quite certain in that comment if we could get the testing and the equipment that we need. The nursing home would be the safest place for them.
The alarm needs to be sound here. It is this, the nursing homes have been, that was the source of one of the first clusters, was at a nursing home in Seattle. That's why you and I were talking originally. They need a flood of protective gear, just like the hospitals do. It is really unacceptable because this is such a vulnerable population. I need to lean on another part of your resume, if I could, in quite a turn. You're also a former governor of Kansas. The Democratic governor there, like many other governors, put limits to religious gatherings as part of her stay-at-home order. Just yesterday, Republican legislative leaders there revoked that order, obviously, and it's days before Easter. What's your reaction to that?
Well, I support Governor Kelly 100% on this. We need governors to overreact right now, not underreact. And I think that when we look back on the history of this, we will see that governors like Governor Kelly, Governor Hogan, Governor Newsom, the one that shut their states down before it was obvious, when there were very few numbers of cases in their states, I think they will be the real heroes because they will have saved lives not just across the state, also in nursing homes and throughout the entire communities. I know it gets tricky anytime religion's involved, but you know, Easter is it's about sacrifice and life. And we have a chance this Sunday to not just celebrate Easter, we have a chance to live it by all of us making our own sacrifice, creating life, and I encourage everyone to stay home and do that.
Yeah, and Passover is upon us at this very moment as well. Thank you so much for being here. Thank you for what you're doing.
Thank you very much.